Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rouleau. Finally, someone willing and able to blow the top off hidden healthcare and hospital dangers. She's provocative, upbeat, balanced, fearless, fresh. Pat has over 20 years of experience as a professional public speaker and knows how to approach this important subject with enough humor and wit to keep you informed, entertained, and empowered. Each week you will say, "Oh," as Pat explores and exposes little-known hospital hazards, delves into the deep waters of dangerous healthcare practices, picks the brains of her good-looking and influential guests to help keep you and your family safe in today's fragmented healthcare system. The program is not intended to replace medical advice from a licensed professional, but rather to encourage you to become a well-informed participant in your health and well-being. And now, your host, Pat Rouleau.
I can't bear you no more, baby. I got too much pride. But I'll survive.
Hello, I'm Pat Rouleau, and I will be your hostess, your one-stop patient safety radio hostess, where I will spend the next hour serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit. People always ask, who are you? Who am I? I am you. I am every person who has ever been in a hospital or doctor's office and has received less than acceptable treatment. I am you, the person who got an infection during a simple outpatient procedure. I am you, the patient whose questions are ignored, who struggles to speak to the doctor as he or she has one foot out the door. I am the missed heart attack, the hospital-acquired infection, the wrong diagnosis, the unanswered call button. I want this patient safety show to be about you, your family, your friends, and your loved ones. Speak Up and Stay Alive RadiOh. Yes, that is OH with an exclamation point. It will cause you to say, oh, as each week we delve into little-known hospital and healthcare dangers. When you understand why something happens, you are better equipped to prevent it from happening to you. If enough people begin to speak up, together, each of us can alter the current precarious path of today's unsafe healthcare practices. Well, today, we're all dressed up in our best radio clothes. Bob got a haircut, and we are looking spiffy. Why? Well, because today's guest is the world-renowned Dr. Lucian Leape, the father of patient safety today. And we have lots of email questions that we are going to present to Dr. Leape. It's an exciting day to be listening to this radio show, so find a quiet spot. Shut the doors, pull the blinds, turn off any ringing or buzzing devices, and revel in this once-in-a-lifetime opportunity to learn about patient safety from the top guy. But for now, it's time for the healthcare hazard of the week. And that would be not enough time to talk to the doc. Here's the scene. You arrive at your doctor's office for, let's say, a diabetes checkup. The waiting room is filled with people. You dread the idea of sitting there for who knows how long just to have a rushed 15-minute visit with your doctor. But within moments, the nurse opens the door, and instead of calling one name, she calls everyone in the waiting room to follow her. You are led into a conference-type room with tables, chairs, and some light refreshments. The doctor enters, along with a nurse practitioner and a social worker or other healthcare facilitator. Come to find out, all of the other patients have diabetic issues, just like you. You are welcomed to a 90-minute visit with your doctor? What world are you in? Well, this model of care is called a shared medical appointment. During my last speaking event, I was at the Ohio Hospital Association speaking to the folks there, and a couple of the attendees came up to me and talked to me about this idea and shared their thoughts. And I thought, wow, I'd like to talk about this with you, even though it's not a new idea and it has been in practice for a while. But since many folks have not heard about this, let's give it a chat because actually it's quite timely. Under the Affordable Care Act, a huge amount of people will need health care, and the question is, how will medical professionals accommodate everyone? It's projected that an additional 34 million people will receive health insurance and will need over 51,000 more primary care physicians by 2025 to meet that need. To solve this problem, some physicians are practicing shared medical appointments. A shared medical appointment is a 1 or 2 hour doctor appointment in the company of other patients who share conditions similar to yours. In shared appointments, physicians do what they would normally do in a typical 15-minute visit: discuss your personal medical concerns, ask questions, do the necessary physical exams, order tests, prescribe or refill your medications. Now, if you need a physical exam, it's completely private outside of the group. So it's an actual normal office visit, and it's billed as a regular appointment. There's no extra charges for the extra time you spend with the physician. And your insurance will cover this as a typical office visit, and typical copays apply. So what might be the advantages of a shared medical appointment? In theory, the advantages are more time with your physician, no waiting room time, increased access to your doctor, and the opportunity to learn from the questions and comments of others. You may leave with a great deal more information, be able to get answers to important questions that you might not even know to ask, but others would, and perhaps you might even make new friends. Shared appointments also help ease the patient's feelings that they're the only ones dealing with the circumstances of that particular disease. Now, for doctors, it makes economic sense. A normal follow-up doctor visit is usually 15 minutes? So traditionally, in 90 minutes, a physician can see 6 patients. In a shared appointment, a physician can see 8 to 10 or even more patients in the same amount of time. So how exactly does it work? Anything you would normally do in an individual office visit can be done during a shared appointment. During the appointment, the physician circulates around the room and talks with each patient individually about their health issues and orders prescriptions or tests as necessary. Say for diabetic patients, for example, the doctor might review blood sugar levels, talk about diet and exercise, and discuss medication use. The nurse practitioner helps out as well, as so does the social worker and the facilitator. Now, patients will benefit from the same privacy and confidentiality standards of a conventional medical appointment. All personal information discussed during the visit remains confidential. And in fact, all patients sign a notice of confidentiality, and all guests, including family members, will be asked to sign that same confidentiality statement that the patients sign. So when did this begin and who came up with this idea? Shared medical appointments were developed and established in 1996 by Dr. Edward Knopfsinger, a psychologist at Kaiser Permanente. And by the way, this esteemed gentleman will be a guest on the show in the coming weeks. So stay tuned, or you could visit the website, speakupandstayalive.com, for those dates. Actually, at Harvard Vanguard, a survey of 720 patients found that 77% of patients who had a shared appointment said that they would schedule one again. So you might ask, what type of patient might benefit from shared medical appointments? Well, probably patients who need routine follow-up care, maybe due to a chronic condition such as diabetes, asthma, weight management, preventive cardiac care. I would think, though, that shared appointments are not appropriate for every patient. For example, the program is not designed to be used as a first-time consultation or to treat an urgent medical crisis or to diagnose and treat complex medical care. Now, here's some comments I've heard from folks when discussing the idea of shared medical appointments. Some say that it might be difficult to interest patients because it's such a radical change from what we're used to. And perhaps many patients are reluctant to discuss private information with other people. And speaking of confidentiality, all patients must sign this confidentiality agreement, which states that they will not disclose any confidential information about others after the visit. And it also allows the doctor to discuss the patient's medical history in front of the group. For me, I'm not sure that the signing or swearing to anything means what it used to. We're so used to watching our government officials give testimony under oath and then, without a blink, carry on and perjure themselves. Call me skeptical, but I wouldn't trust some random stranger not to leave and share every word with his or her spouse or friend. But maybe that doesn't matter unless you're a high profile or a well-known person. Then there's always one person who doesn't know when to stop talking and overrides the entire conversation. You know how it is. Everyone loves to talk about their health issues. Oy, when I had my knee surgery, let me tell you. That's why I never joined my kids' PTA groups. Too much random yakking. Also, you may be getting an hour or two of FaceTime. That is, looking at your doctor's face. But are you really getting any more devoted one-on-one time than you would in a traditional appointment? And what about the ever-present concern about cross-contamination? I'd be especially concerned if the doctor wandered from patient to patient using the same stethoscope, not washing hands between patients, not changing gloves. I saw a picture of a shared pediatric appointment that showed a room full of parents holding babies and a single doctor attending to them all. There is no way I would spend 90 minutes in the same room with crying, diapered, coughing, sneezing kids. But then there are many instances where the group setting has benefits. Other patients may ask questions or raise issues that you might have forgotten or not even known to ask. And then there's the simple issue of simply having the space and the place to share with others who are in a similar situation. Regardless of the illness, there is a commonality between patients, and the group setting can help to relieve the loneliness and isolation. And so many women I talk with say that the men in their lives seldom speak up during a doctor visit. Typically, a man will not ask a lot of questions during a one-on-one doctor visit. So in a shared appointment, perhaps just hearing others' questions and answers might help to inform and empower these shy guys. To exemplify this point, here's a story from Dr. Knopfsinger's blog that explains how the sharing during a group appointment made a positive impact for everyone in the room. The doctor had been caring for a patient who was suffering from a chronic illness for many years. From the doctor's perspective, the illness was deeply compounded by his patient's recurring bouts of depression. Despite years of advice and urging on the part of the physician, the patient had refused to either recognize his depression or accept any medical treatment for it. So during the course of this patient's very first shared visit, he rather sheepishly raised the issue of being depressed. The behaviorist in the room immediately picked up on it and began a brief dialogue with all the patients present, the majority of whom shared that they had also struggled with depression. A number of the patients described how their depression had held them back from getting better. Immediately after the session was over, this patient smiled and leaned over to the behaviorist stating, "I helped all these other patients, didn't I?" At a follow-up visit 3 months later, the patient reported that he had, in fact, followed up with the treatment plans for his depression. So I guess there's a lot to consider when contemplating a shared medical visit. If you're curious about it, ask your doctor or hospital if they offer this type of appointment and if it might be right for you or someone you care for. And let's continue the conversation. Here's 3 questions I have for you. We can then share them with Dr. Knopfsinger when he joins the show in a few weeks. Number 1, have you ever participated in a shared medical appointment? And if so, share your feelings about it. Number 2, would you participate in a shared medical appointment? Why or why not? And finally, are group visits or shared appointments a step forward in patient care, or is it a way to stretch resources? Email me your thoughts at speak@speakupandstayalive.com or call me 440-725-5462.
It's always more fun to share with everyone. It's always more fun to share with everyone.
Let's spend the next 2 minutes with my friend Hari Khalsa, better known as the Healthcare Whisperer. In her role as a healthcare advocate and as a family nurse practitioner, Hari knows how to navigate the healthcare system and works with patients all over the country and can help you find the answers you may not get without her. Well, today, Hari, let's talk about second opinions. Why should we get one?
Well, it's really important to get a second opinion because anytime you get a new diagnosis or given a new treatment or a medication and you're not really sure what it's all about and you want to just find out some more information, I really think it's important to ask another doctor because you'd be surprised how many doctors disagree on treatments. And so it's really important to go and find out if there's any other ways of going about treatment. And I see this a lot with patients, and I tell all my patients, I say, anytime you get a new diagnosis, I'm always saying, go get a second opinion. And go get a second opinion from somebody outside of the practice that your doctor is in. Someone completely neutral who doesn't maybe know your doctor or is in a different town. And just have them do a consult. Give them all the information, all your tests, all your papers, and ask them what they think. And you'd be surprised what you might find out. Very important. And it just gives you more information to work with. And I think that's really important for patients to have the most information so they can make an informed decision about their care.
Absolutely. That is excellent advice. Hari, how can our listeners find out more about you, and where can they contact you?
Well, they can go to my website at healthcarewhisperer.com. They can contact me at 866-980-4325. They can also find me on Facebook at Hari Khalsa or on Twitter at HariK108.
Well, great. Thank you, Hari, for sharing your wisdom with us today. It's always a pleasure to talk with you, and we look forward to your return next week.
Oh, great. I look forward to it. Thank you so much.
Thank you. And remember to visit Hari at healthcarewhisperer.com.
I'm Jerry the Germ, here to spread healthcare and hospital safety tips all over the airwaves. Here's our expert, Pat Rulo.
Jerry, did you know bacteria can live on fabric for up to 90 days? When you visit a hospital, dangerous germs can land on your clothing. And because bacteria is invisible, you have no idea what danger lurks on your clothes and shoes. When you come home and plop on your couch, you can transfer the germs from the hospital to your home. Keep you and your loved ones safe from unnecessary cross-contamination. Get undressed at the back door. Now there's a visual. Stay safe. Listen to Speak Up and Stay Alive Radio. For more information, go to speakupandstayalive.com.
Brought to you by Generation America, the smart, conservative, and traditional 50-plus membership organization. Generation America cares what their members think about the issues affecting seniors and ensure their voices are heard. Generation America, on the right side for seniors. To join and to find out more, visit generationamerica.org.
You are listening to Speak Up and Stay Alive, Patient Safety Radio, the only program that brings you weekly world-class guests and patient safety tips and tools that you can immediately use, all wrapped up in an entertaining, positive, and listener-friendly way. I am your hostess, Pat Rulo, and right now I have a treat for your ears. For all of you listeners who have spent 30 seconds within the patient safety world, you will certainly recognize today's guest. I am proud to share the air with Dr. Lucian Leape, the Harvard physician, also considered the father of the modern patient safety movement. He is responsible for the eye-opening Institute of Medicine's report, To Err is Human, the report that found that up to 98,000 Americans die every year from preventable medical errors made in hospitals alone. He is also the chairman and the namesake for the Lucian Leape Institute at the National Patient Safety Foundation located in Boston, Massachusetts. I could go on, but we have so much to talk about. So welcome to our show, Dr. Leape.
Well, it's nice to be here, Pat. Thanks for having me.
Oh, it's our pleasure. You know, since this show is all about our listeners, I thought it would be appropriate to reach out to them and ask them to write and send their questions for you. So we sent a huge email blast, Facebook, Twitter, at your arrival, and we received well over 100 responses. So unless you want to spend the entire day with us, we categorize them, and we have several for you today. So are you okay with that format?
That's just fine.
All right. All right. In no specific order. Jane in Orlando, Florida wrote, Dr. Leape, you assisted in writing the report To Err is Human that concluded that between 44,000 and 98,000 people die each year as a result of preventable medical errors. 2 questions. Are those numbers higher or lower today? And are there any new reliable reports reflecting the current situation?
Well, that's a good and very reasonable question, and I'm afraid I don't have a good and reasonable answer. Those numbers came from actually a study we'd done back in the 80s, about the only population-based study in which we really tried to find out the injury rate for all the people who lived in one state. It was New York. And the Institute of Medicine extrapolated those numbers to the United States as a whole. And there hasn't been a repeat of that kind of study since. There have been some smaller studies that have been done, and they show the numbers really aren't a whole lot different. Now, that may be because we're much better at finding errors now, but it's still rather disconcerting that we can't show any major changes since those numbers were done now 15 years ago. There are two big problems in studying medical errors. One is people have to recognize when something goes wrong that it was because of a mistake. And secondly, it has to be reported. And we don't do real well on either of those things. So I think we have to say we really don't know with any real reliability what the numbers are.
Sure, because there's no mandatory reporting, so how are we really gathering those numbers?
Exactly. What you do is you measure in one area and then assume the whole country's that way, and of course you can't do that.
Right. Okay. I just see people quoting those figures all the time, and I was also curious about that. It's like, wow, are we using old data, or is there really nothing to talk about as far as new? Yeah.
Right.
All right. Jake from Salt Lake City, Utah asked, what is the current state of patient safety today? Where have things improved, and is anything in particular getting worse?
Let me answer the second one. I don't think things are getting worse. Things have improved. It's never enough, never fast enough, and will never be completely safe. What we do is journey toward it and do our best to try to get there. But it's a constant effort and always will be. We've made some real progress in terms of implementing safe practices. When we came out with the Institute of Medicine report in 1999, we said, quit punishing people for making mistakes. It's not their fault. It's bad systems. Change the systems. And then we sort of said, we didn't literally say it, but we sort of said good luck because we didn't have a whole lot of new systems to recommend. That's changed dramatically since then, thanks to the work of the National Quality Forum and thanks to hundreds of researchers all over the country. We now have a whole portfolio of safe practices, that is, ways to do the things we do in the treatment of patients that we know will make it less likely to make a mistake and less likely to hurt people. And we've had a huge effort to implement those safe practices. Some hospitals, some systems have done a fabulous job. Others have just done a little bit. But everybody's done something. So we've spent the time since the Institute of Medicine report essentially focusing on implementing safe practices. I think we've clearly reduced the rate of infection in hospitals. There was a report from the CDC, the Center for Disease Control, last year that said there was a 40% reduction in infections in central venous lines, for example, which was a very serious problem. It was a killer.
Right.
And that's been improved. Significant reductions in resistant infections, in surgical site infections, urinary tract infections. So we've made some significant progress in terms of infections. We made some significant progress in reducing medication errors. Many hospitals have barcoding now. Everybody has better systems than we did. So I think we've made some real progress. It's just that it's never quite enough, and people are never happy with the progress as long as we're still hurting people. What we've found is as we have implemented these safe practices, or as we've tried to implement them, that it's not quite as easy as just saying, everybody disinfect your hands. That's it. People just don't change that readily, and we're beginning to realize that the real challenge isn't really knowing what the safe practices are. The real challenge is changing our culture to one in which everybody is aware of and sensitive and feels responsible for patient safety every minute of every day. We have to make hospital people like people who work on aircraft carriers or people who fly in airplanes, in which their focus all the time is on safety. We've still got a long way to go on that.
I think as the normal everyday person has the increased awareness that these issues do exist, then we're going to create a demand for the culture to change, I'm hoping.
I think so, and I think that's already happening,
yes.
And that's a good thing.
Yeah, it is a good thing. All right, Barbara from Mesa, Arizona, Facebooked. When people think of patient safety, they think of safe clinical outcomes. What about the trauma of being treated poorly by healthcare providers? They don't listen, don't speak so patients can understand, and don't behave with any soft skills. Isn't this a form of patient harm?
It certainly is, and we think this is a very important issue and far too common. There are too many stories. Too many people can tell you how badly they've been treated. I have to say, I really still believe they're the exception. Certainly in my experience, 25 years as a practicing surgeon, I knew very few physicians or nurses who really treated patients badly. Most of the nurses I know are kind and caring people. That's why they went into medicine.
Right.
But if it's even 5% of people who treat people badly, that's too many and causes a lot of harm. we think this is a very important issue. We're beginning to talk about it in medical school, and hospitals are beginning to do something about it. More and more hospitals are insisting that the most important thing that people who work in a hospital need to do is treat everyone with respect, treat the patients with respect, treat each other with respect. And we've got a big effort going to improve that.
Right. Yeah, I agree with you. It is the exception, but boy, even if it's 5%, that's what people remember, and that's what they talk about.
Exactly.
Yeah. All right, we have Kim emailed, are new doctors being trained to consider not only patient safety, but the patient experience as a whole?
They are. I think we've made some real progress on that. The classical way we've measured success in the past has been the outcome of the treatment. So if you had appendicitis and you had an operation and removed the appendix and you got well, we considered that a success. We then became a little more sophisticated and realized it wasn't merely enough to have the treatment be successful. The patient had to fully recover and be able to go back to a useful life. And so we focused for a while on what were called activities of daily living, whether people could do what they wanted to do. Could they dress themselves, get out of bed, and feed themselves, work, and so forth. I think we've moved on to the third level, which is the whole overall patient experience, which is satisfaction, but more than satisfaction. It's being feeling that you've been treated properly and adequately. And we're beginning to measure that. And like anything else, until you measure it, you don't know where you are. I have the privilege of serving on the Board of Trustees of a hospital, and board and the staff and the quality division are very concerned about patient response. And they take patient complaints and the results of the surveys very seriously. So I think we're doing a lot on that, and I think medical students are beginning to learn about it as well.
I heard that, I don't know if it's 2013, 2014, the MCATs are going to include questions on some of those softer skills?
I've heard that too, although I haven't seen it.
Okay, all right. All right, Beth in Greene County, Ohio asked, what do you think of hospitals being publicly transparent? Shouldn't they be required to post all aspects of medical harm, such as infection rates?
Absolutely. I agree 100% with Paul O'Neill, who says that every hospital should be required to post all their harms every day. I think infections would be a good place to start because infections are pretty easy to recognize and pretty hard to fudge. So you can clearly know how many patients got a urinary tract infection or a bloodstream infection or whatever. I'm a tremendous advocate of transparency. The Lucian Leap Institute at the National Patient Safety Foundation has been focusing on some of these issues, and the next one we're tackling, we're going to have roundtables of experts and hopefully issue some useful recommendations, is on transparency, because we think it's essential. It's an essential right, but in addition to that, it's essential for making healthcare safe.
Sure, and I think as patients, you would almost have more trust in an organization who felt that they were able to give you that information outright rather than A, either have you ask for it, or B, not even make it available when you do ask.
Well, that's a very important point. Did I understand you had Paul Levy on?
I did.
Well, he was one of the first to do that, as he probably told you. It was interesting because when he went public with some of their bad news, everybody said, that's going to really do them a lot of harm. It was the other way around. It really improved the reputation of the hospital because people know you're not perfect. When you talk about it and admit it, they then feel, you may not be perfect, but at least you're honest.
At least you're honest, yeah.
So I can trust you.
Yes. Yeah, I have great respect for him being able to step out of the box and do that. So many questions. I'm sure we could go on and on and on. So where do we go from here? And what are your suggestions to improve patient safety today?
Well, I think there's two aspects of that, and that is what should we be doing in the medical establishment, and the other is what can patients do.
Right.
And the answer is we should be doing everything. I mean, we should be changing our culture. We should be implementing our safe practices. Every hospital now has a patient safety officer. Most hospitals have active safety programs, but we need to do a lot more. And the agenda is big, and people know it, and it's really a matter of getting on with it. In terms of what patients can do, I think patients can do a lot more. One is to put pressure on sort of every different aspect of the system and, in essence, politicize it in a sense. That is, boards of trustees ought to know that there's a problem in their hospital. I think patients should speak up, should write, should organize. Whenever things are not right, let everybody know about it. Let the physician know, let the hospital know, let the board know. I think every hospital ought to have a patient advisory board. They ought to be more than an advisory board. They ought to be part of the participation in the hospital activities, and patients should push for that. And I think it's important to speak up is the main thing. One of the most striking things is that we may have 98,000 people die from medical errors, but we don't have 98,000 complaints about it.
Interesting.
And we really need to have more public outrage and say it's time to stop this and do what needs to be done. And I'd really welcome that.
There's no central clearinghouse. You've got a group here and then a patient advocacy group here and then one here and there, and they're scattered throughout the country, but nobody comes together. So maybe we do have that amount of voices, but they're all over the place. If there were a central place where we could say, yes, I can go there, I know that my voice would be heard.
Well, go organize it.
All right. That leads me to my next question. What do you think of radio as a medium to inform and empower patients?
Oh, I think it's superb. Of course, I'm old-fashioned. I grew up with radio, so I'm a great believer about it. But I think the way you do it, there is interchange back and forth. I mean, you used to have questions coming. It's not just us preaching. I like most academics, I go around and give talks to people, but that's a one-way conversation. I think this is much better.
Dr. Leap, it has been a pleasure and an honor, obviously, to have you with us today. I thank you for taking the time to answer our listeners' questions, and you are welcome on this show anytime.
Well, thank you, Pat, and thank you for all you're doing to help make the healthcare safer. We really appreciate it.
Once again, we have my friend Elizabeth Bailey with us, and she is ready to share some valuable patient safety checklists with us found in her book, The Patient's Checklist. Listen as Elizabeth spends the next 2 minutes with us to share some of her easy-to-use checklist tips and tools. Well, here's a question for you, Elizabeth. If you cannot be with your loved one all the time, I'm guessing that there's certain important times to be there. What times might those be?
One way is to organize a schedule where you stagger visits, so you will always have someone with you at key moments when mistakes and miscommunications can happen. And these tend to be at times of transitions. It's important to have someone with you, if possible, when your nurses change shifts, because that way you're overlapping with the two nurses and you can find out what has happened that day. Is all the right and appropriate information being relayed? Medication times, so that you can monitor your loved one's medications. If you're there when that medication is supposed to be administered and it's late, you can flag it with the staff. Oftentimes, I think it's important to find out, when do doctors do their rounds? Because you can wait for hours and they don't show up when you're there. But if you know that this particular doctor always does his rounds at 7 a.m., you can be there at that time and you can discuss whatever concerns your loved one or you may have. So I think the most important times are shift changes and moments when your care is transferred.
Great advice. And tell our listeners how they can learn more about you and where they can purchase your book.
My book is on Amazon, but you can find out more about my book and me by going to my website, thepatientschecklist.com.
Well, Elizabeth, I thank you for sharing your wisdom and advice with us today. You and I have had similar paths, and I am happy that those paths have crossed. And you're a welcome addition to our show, and I look forward to more of your tips next week.
Thank you very much for having me.
One of the most thoughtful things you can do for your family is to leave detailed funeral information of your wishes. Making funeral arrangements at the time of loss is extremely difficult for those left behind. Pre-planning is easy, especially when you work with my friends at Mountain View Funeral Home and Cemetery. Remember, planning is bringing the future into the present so that you can do something about it now. I encourage you to begin the conversation and call Mountain View Funeral Home and Cemetery to receive the information that will guide you in a most helpful and gentle way. To schedule a confidential and free consultation, visit mountainviewfuneralhomeandcemetery.com or call 480-832-2850.
This segment is brought to you by Mountain View Funeral Home and Cemetery on East Main Street in Mesa and Santan Mountain View Funeral Home and Advanced Planning Center on South Ellsworth Road in Quinn Creek. They're family owned and operated and have served the East Valley for 61 years. Visit them online at mountainviewfuneralhomeandcemetery.com or call 480-832-2850.
You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rouleau. So happy to spend this hour with you to help you survive any healthcare or hospital encounter. And remember, if you like what you hear on this radio show, I speak live and in person too. In fact, we're even better in person. Our presentations are fast-paced, interactive, and chock full of immediately usable patient safety tips and tools. I can guarantee that your crowd will love it. So email or call me to talk about speaking to your business, club, church, hospital. I speak both to the patient perspective or the provider. Email us at speakupandstayalive.com or call me directly at 440-725-5462. You and your audience will be glad you did. Well, today we opened the game chamber and everyone decided to play one of our newest games. Are you in jeopardy or are you safe? Here's how it goes. I will describe a healthcare or hospital-associated scene, and you and our contestants will have to decide how you would react to that situation. Are you in jeopardy, or are you safe? Well, let's see who our two contestants are.
Is Don in the booth? He's ready. Okay, here we go. In 5, 4, 3, 2... Cue lights, music.
Now entering the studio are today's contestants.
I'm Bob from Gatlinburg, Tennessee, and a former financial planner.
All right, and contestant number 2 is...
I'm Eric. I'm from Lakewood, Ohio, and I'm a regionally famous radio producer in Northeast Ohio.
Regionally famous. This is good.
These people will compete today on...
Are you in jeopardy, or are you safe? Bob, you've got some stiff competition today.
I'm in trouble.
All right. You guys ready?
Let's go for it.
Let's go.
All right. Here's the first scenario. You are a patient in the hospital. Your nurse knocks, enters the room, introduces herself, washes her hands, and asks your name, and then sits down to speak with you. Are you in jeopardy, or are you safe? What do you think, Bob?
I think you're in jeopardy.
You think you're in jeopardy. What do you say, Eric?
All right, I'm sorry. Somebody actually just walked in while you were saying all that, and that distracted me.
No, sorry.
I'm sorry. It's just this long list of details I'm having trouble keeping up with.
All righty. Bob, you said you're in jeopardy?
Yeah.
I'd say you're in hospital heaven, guys. What a thoughtful way to enter the room. With an introduction, she sanitized her hands without being asked, verified your name as the correct patient, and sat down to have a real conversation. I like it. All right, guys, here's scenario number 2. 3 weeks ago, you got a new prescription and had it filled at the Looks Right pharmacy. Last week, you had another prescription filled at a pharmacy closer to home. Today, you're out of town and have the newest one filled at the local pharmacy across from the hotel. Are you in jeopardy or are you safe?
I'm going to say you're in jeopardy because you should use only the same pharmacy.
And what do you think about that one, Eric?
I'm kind of wondering how much dosage you'd be getting having all those prescriptions filled.
Absolutely. You hit it on the head. We talked about this on the show. To avoid drug interactions, get all of your prescriptions filled at the same pharmacy or at least the same pharmacy chain. In this way, the computer system will flag any dangerous combinations if you're taking too much. Plus, a pharmacist is a great resource. I'd say get to know your local pharmacist. Good answer, guys.
Oh, we did good, didn't we, Eric?
Yay.
Yay for you. All right, here's scenario number 3. Your friend is a patient in the hospital. You notice that she has had a urine catheter for over 3 weeks. Is she in jeopardy or is she safe?
I think, based on your show, catheter infections are the number one cause of infection. And the faster you can get them in and get them out, the better off you are. Anytime it's in there for a long time, you're in trouble.
What do you say, Eric?
I couldn't add anything to that.
All right. You guys are right. I'd say anytime you have anything invasive entering your body, you are at risk for an infection. And catheter-associated urinary tract infections are one of the most prevalent cause of a hospital-acquired infection. You're right, Bob. Inquire daily if the catheter is necessary and when it will be removed.
Well, a lot of the nurses don't want to remove it because then they have to come and answer the call button to take the person to the bathroom.
That's true. It's not a convenience. There's so much more to know about this. You can find out more in my book, Speak Up and Stay Alive. All right, here's scenario number 4. You're heading to the hospital for surgery that will keep you there for days. You grab your favorite pillow as a comfortable reminder of home. Are you in jeopardy or are you safe? What do you say, Eric?
I would say, considering how long it's been since I last washed my favorite pillow, everyone would be in jeopardy.
That is a good answer, Eric. But I wouldn't even take my favorite pillow to the hospital. I'd go to Walmart and buy one.
Well, Eric's thinking he would contaminate the people, and you're thinking that the hospital pillows would contaminate you and bring it back home. And you're both right. I would not do that. I would not bring a pillow. There's so much bacteria floating around a hospital room. Think of the many people who will touch it, fluff it, move it, transfer it from bed to table to chair, and perhaps to the floor. And all the while, it becomes a vector for cross-contamination when you bring it home. So I suggest if you want to bring a pillow from home, what Bobby said, buy a cheap one, keep a stash in your closet. Then if a hospital stay pops up, bring that pillow with you and leave it there when you leave as a parting gift. Personally, I would not bring it back home with me. But then again, maybe I think about these things way too much, right? Yeah?
You got it.
All right. Here's scenario number 5. You are heading to the hospital for elective knee surgery. Before you dash out of the house, you grab your marked up copy of the book, Speak Up and Stay Alive, your hospital survival guide. And when you get there, you lay it on your tray table for everyone to notice. Are you in jeopardy or are you safe? What do you think, Eric?
I'd say you're safe. It shows the doctors and the nurses that you're watching.
Yep. I think you're right. What do you say, Bob?
Oh, definitely safe. Everybody ought to have a copy just to get along.
You guys are awesome. That is a great way to send a nonverbal message to everyone who enters your room that you are interested to be informed. Plus, the tray table is where everyone likes to put their stuff, bandages, blood drawing supplies, meal trays. Now, they either have to move the book or at very least look at it, right?
You got it.
It's a non-threatening way to connect with your providers and let them know that you're informed, concerned, and an empowered patient. Well, guys, I'm not sure who won that.
I think Bob won.
Oh, listen to him.
Well, I think you're both winners because you both know a little bit more about patient safety.
If I won, what would I have got?
Does he get the home game?
Oh, he should get the home game. But do we have the home game?
That's the question.
Very good. Thanks, Eric. Hey, listeners, don't go anywhere. There's so much more you can learn about healthcare and hospital safety on America's favorite and perhaps only patient safety radio show, Speak Up and Stay Alive, Radio. Listen as I spend the next 2 minutes with Casey Quinlan. She wrote the book, Cancer for Christmas, Making the Most of a Daunting Gift. Casey, we are going to challenge you today with a little game of sorts where you have to answer the next set of questions with a 1 or 2 word answer. When you go for a doctor visit, what is on your must-ask list?
How much is that?
All righty, good. Talking about cost transparency. Next, if you were going to the hospital, what would you pack?
I would pack my tablet or laptop for the ability to research. All hospitals now have open Wi-Fi.
That is an excellent answer.
Roger.
All right. What is your favorite patient safety word?
Why?
Excellent. You win. All right. Prior to a medical procedure, assuming it's not an emergency, what should we be saying or asking?
Why?
I knew you were going to say that.
Channel your 3-year-old self talking to your parents. Why?
That's really good. I'm going to use that. Our last one. After you run in with a life-threatening illness, how do you celebrate life?
Oh, every day. I'm just glad to be here. I think I should have a tattoo on my forehead. Happy to be here.
Oh, I could tell by your laugh.
I'm happy to be here. But then I was kind of happy to be here before. Now I'm happier to be here.
Well, we're happy that you're here as well. Give us your website if you would.
Well, I have 2. I have mightycasey.com, and I also have Cancer for Christmas, all spelled out, .com. Either one of those will give people a way to get in touch with me. So anybody who wants to get in touch with me, trust me, I'm not hiding.
It's such a pleasure to have you with us today. You are energizing, and I encourage our listeners to find you online and connect with you, mightycasey.com. Thank you, and please come back.
I will. Thank you.
On this show, we talk about the need for a patient advocate during every healthcare or hospital encounter. But advocacy also includes whom you rely on when it comes to health insurance. And when it comes to your Medicare supplement plans, you must compare. Listen while I spend the next 2 minutes with Chris Alberta, the Medicare supplement partner with Generation America, as we discuss the importance of choice. Chris, can you tell us how are you and Generation America different when it comes to choosing a Medicare supplement plan?
They're doing something, Pat, that is really unique. What they said to us was, how can we offer everybody who's a member of our organization basically a menu? Many people don't know this, is all these Medicare plans, most of them are exactly the same coverage. The only difference is the price that you pay. We work with probably upwards of about 50 different programs and carriers around the country, which is most of them. And Generation America hooked up with us and said, listen, how can we show our members every single program that's available in their zip code, and then really break it down according to age and price so they never end up overpaying. All of the reps that work for us have been licensed and trained in this kind of work, and most of them have worked in the field, Pat, actually at the kitchen table with folks. So they're not just, like a sales bank somewhere. They really care what you get, and we pay them exactly the same either way, which is cool because there's no incentive to ever recommend one product or one company over another.
That is great to know. People need choices, and they need to feel safe when they make those choices. So how can our listeners find out more, and where can they purchase the proper Medicare supplement for themselves?
Well, the website, generationamerica.org, is the main portal. That's the front door, really, for that team.
Well, thank you for spending the time to clarify Medicare supplements with us today, Chris.
No problem, Pat.
Remember, folks, Generation America is on the right side for seniors. For more information or to join, visit generationamerica.org. You're listening to Speak Up and Stay Alive, Patient Safety Radio, every Saturday morning in Cleveland, Ohio, and every Saturday and Sunday morning in Phoenix, Arizona. I am Pat Rulo, your hostess and author of the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, available at all of our live speaking events and at our website, speakupandstayalive.com. That's where you can also locate radio showtimes, dates, and station information. That's speakupandstayalive.com. And if you want to purchase the book but do not have internet access, it's okay to call me. Lots of folks order the book by phone, so give me a call, 440-725-5462. Well, today we talked about shared medical appointments. What do you think about this? Would you feel comfortable sharing your doctor visit with 10 other patients? Email us your thoughts and experiences. And our guest today, the Dr. Lucian Leap, answered many of your questions about patient safety and the patient experience. We will have him on again soon. It's a proud day for all of us to share the air with this respected gentleman. And if you missed some of today's show and you want to hear it in its entirety, simply go to the radio link at the website speakupandstayalive.com. There you can listen to today's show. And you can also purchase the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, written by me, just for you. And if you do not have a copy of this important book, you are missing some seriously valuable patient safety ideas. It's easy to read in short sections, highlighted with real-life stories that my mom and I lived through that prove the need for this kind of knowledge. So between the book and the weekly radio shows, I think it's safe to say that you may be adding years to your life or to the life of someone you know and love. So set your alarm clocks for Saturday and Sunday mornings and tune in. And tell your friends, patient safety should not be a secret. Start your week with an O. Speak Up and Stay Alive Radio. Oh, and be sure to listen next week because our guest is Jason Wolf, president of the Barrel Institute in Washington, D.C. No, not spelled like a barrel of monkeys or a barrel of wine. Beryl, B-E-R-Y-L, Beryl Institute, the globally recognized thought leader on improving the patient experience in healthcare. I am excited about that. After all, that's what this show is all about, improving the patient experience, whether it be through safety measures, acknowledging hazards, or simply expecting a sanitary handshake from our doctor. And again, as we've talked about before, what exactly is the patient experience? Jason Wolf will have the answers, so call your friends, your neighbors, your in-laws, and even your outlaws, and tell them to cancel all plans. Mark your calendar, set your alarms. For when? On Saturday mornings in Phoenix, Arizona, from 6 to 7 Mountain Time on AM 1360 KPXQ. And then on Sunday morning in Phoenix, you can listen from 9 to 10 Mountain Time on AM 960 KKNT. Or you can always listen live via the internet from anywhere in the world. Check the SpeakUpAndStayAlive.com website to find out how. In the meantime, I hope you have a healthy and a happy week. I am Pat Rulo, and I am your guide to safe and successful healthcare and hospital encounters.
The information provided in today's broadcast is for informational purposes only and was not intended for use as diagnosis or treatment of a health problem and should not be considered as medical advice. If you've missed part of today's show or just want to share the information with friends, you can listen to all of Pat's previous shows at SpeakUpAndStayAlive.com. Want even more information? Purchase a copy of Pat's book at SpeakUpAndStayAlive.com. Once again, it's SpeakUpAndStayAlive.com.
Thank you. Thank you very much. Thank you.
Generation America supports Speak Up and Stay Alive Radio. Generation America, the smart, conservative, and traditional 50-plus membership organization. Generation America cares what their members think about the issues affecting seniors and ensure their voices are heard. And they provide a full range of benefits to members. If you're looking for quality Medicare supplement, their rates are lower than the other 50-plus organization 3 out of 4 times. Generation America, on the right side for seniors. To join and to find out more, visit generationamerica.org.